Alberta is planning sweeping new restrictions on access to medically assisted dying, and they are sparking debate across this country. The Smith government has the majority to pass the changes, which would turn back the clock to when MAID was first made legal. The changes are also in anticipation of potential expanded access by the federal government. Albertans would only be able to access MAID if their death was reasonably foreseeable within 12 months, and it would be banned for those suffering solely from mental illness. The bill would also restrict how doctors communicate about MAID with patients. Now, medical assistance in dying is controversial for many, not just between provinces, but certainly for families. Carrie Bowman is a professor of bioethics at the University of Toronto and joins us today. Good morning.
Good morning.
This is intensely Have you ever seen an issue, a health issue in this country that has been as divisive as MAID?
No, I have not. And you know, when things are profoundly divisive, for us ethicists, that's actually a sign that there's deep ethical tension. And it's divisive amongst us, but it's also divisive amongst our provinces, as we're beginning to see.
So there are a number of pieces to this. I want to be very clear, because although the Premier has talked about barring access to kids, there is no province that allows medical assistance in dying for kids, and no province that's considering it, and the federal government has made clear they're not going to. But those suffering solely from mental illness, that is a different conversation.
Yeah.
There is nowhere in this country right now where that alone would give you access, right?
Yeah, and that's something we've pushed back and pushed back and pushed back. And when I say push back, I mean federally, right? So that's a deep issue. And look, the fact that provinces are going to do some fine-tuning and adjust it to their people in a democratic way, I mean, I think that's very, very reasonable. But the language that, you know, I'm hearing yesterday from the Premier Smith, et cetera, you know, access to medical assistance in dying for people with a mental illness, it's not about somebody that's depressed and wants to stop being depressed per se. It's not about an acute crisis. It's about someone with a long-term, untreatable or unsuccessfully treatable mental illness. That's what it's about.
Someone whose life is never going to get better.
Well, never's a tough word, isn't it? Right?
Yeah.
And you know, never's not a great word in medicine, but all indications are they're not going to be able to recover. Because, you know, and a lot of people are opposed to that. And look, I'm conflicted on it myself, but a lot of people don't realize that for some people, they really don't respond to treatment. And the deep ethical question is, and look, I've worked in both. I've worked in psychiatry, I've worked in oncology, I've worked in hospitals most of my life. And, you know, to say that the kind of suffering, you know, that you experience from an aggressive cancer is not equal to the kind of suffering that you experience from a prolonged mental illness, I think is really, really unfair. The mental illness issue that's toughest is poverty, homelessness. You know, the amount of people with mental illness that are living below the poverty line is incredible. So that's the deeper issue. And this legislation doesn't do anything related to that. That's not what this is about. So it's tough.
It is tough. There are a number of other issues in this legislation which are curious, and you know, some of it is around what healthcare practitioners, nurse practitioners, physicians can say to their patients. And essentially that they can never initiate the conversation if this legislation goes ahead. But it goes further than that. It says you can't have information pamphlets, you can't have posters. Are you rolling your eyes? Tell me about that.
Yeah, I'm rolling my eyes because, you know, I'm thinking about autonomy. And, you know, people really have a right as Canadians to know what their options are. That's the Canada Health Act. That's everything. So to simply say we can't talk about it, no pamphlets. And what I find very troubling with this proposal is you cannot make an effective referral to another province. So you can't say we can't do that here, but you know there are other provinces where you could talk to them. Can't say that, right? So I find that very, very restrictive. And also, you know, people that are expected to die within 12 months, you know, doctors don't really talk like that anymore. Like the old movies, you had 3 weeks to live and 3 months to live, you know, and wisely they don't. So that's also going to be very, very problematic. There's also talk about having a family member present. And look, I've seen the vast majority of these cases, there's family and loved ones right there. But in some cases, there's family rifts. there's religious differences, there's issues, and you can't force these things.
Like a child not only doesn't want to be there for a parent's death, but doesn't approve of a parent
Absolutely.
using the
And I've seen these rifts. They're not common. So there's elements of this. Look, provincial fine-tuning, I think, is great. I am very keen to see what the lawyers and legal scholars say as this story plays out, because I can only imagine there'll be significant legal challenges to this.
Alberta has used the notwithstanding clause in the past, and if there are legal challenges, could use it again to essentially force this legislation to be permanent law. We have a long way to go on medical assistance in dying, but conflict is not really the way forward, and I'm really hoping that we can respect some provincial differences without this becoming, a major blow-up. We'll have to see. And Alberta is doing this because they are in many ways getting ahead of what is expected at some point to be an expansion by the federal government. The feds have to open the gateway, and then the provinces can choose whether to go through the door
That's
or not.
Right. And what Alberta's doing, they've knocked out Track 2. So, you have to have a grievous and irremediable, illness right away. So Track 2, long-term disabilities. But please remember, with Track 2, you're talking about 4% of medical assistance in dying referrals, with a huge amount that are declined to begin with. So it's not a flood of things.
Yeah, and let's talk about Track 2, because that is, if I understand correctly, the instance where someone's death is at some point foreseeable, but they may lose the capacity to consent at some
Eventually,
point.
And people living with profound illness and suffering over a long period of time, that would be Track 2, right? And what Alberta is proposing is that there would not be Track 2. So that's a consideration. And some of the things they're proposing are already things, as you've pointed out, that are not, mature minors, no, advanced directives, no, and even primary diagnosis of mental illness is still not legal. I'm not even convinced the federal government's going to act on that. This has become so political, they may not. So we'll see. But I mean, what I worry about as an ethicist is the restrictions to autonomy. Can't talk about it. Very problematic. Can't make a referral to another province. Very problematic. Need family involved. Very problematic.
Kerry Bowman, we've talked about this before. I appreciate you coming in. No doubt we will be talking about it again. It is such an issue in this country.
Happy to do so.
Thank you very much.